Asthma is a very common lung condition that can cause difficulties breathing. If you have asthma, you can have something called an asthma attack. This is where the muscles surrounding your windpipe go into spasm, causing them to constrict the windpipe and making it more difficult for you to breathe. At the same time, you can get a mucus that builds up on the lining of your airway, which once again makes it more difficult for the person to breathe. If you have someone around you that has asthma, it's always a good idea to try and understand what the person's triggers for their asthma attacks are. Things such as stress, exercise, dust, and animal hair can all trigger someone's asthma attacks. So it's always a good idea to understand what these triggers are so you can help someone manage their asthma effectively. It's usually very easy to spot someone who's having an asthma attack. The signs and symptoms include difficulty breathing. You might notice the person grasping their throat and you'll hear this difficulty breathing as the air struggles to get through their system. They'll panic and they'll have a sense of anxiety and their skin might go slightly pale as well. If someone's having an asthma attack, in terms of treatment, one of the most important things you can do is try and calm and reassure the casualty. Usually the casualty panics because they're struggling to breathe, and as a result they can hyperventilate, which means they take short, sharp breaths, and this can make the situation a lot worse. So anything you can do to keep the casualty cool and calm and encourage them to take nice, long, deep breaths is a really important thing. Alongside this, you might try and distract them to try and take their mind off the fact that they're struggling to breathe. Once you've done this, you should try and encourage the casualty to take their own medication. If you have asthma, you'll usually go to the doctor and you'll be prescribed with some form of inhaler to help you manage your asthma attacks. There are two main inhalers that are given out. There's a blue one and there's a brown one. They're used in a very similar way, but they have two different purposes. The brown one is a preventative, so the person usually takes this morning and night when they get up in the morning and before they go to bed. And the chemicals inside this should prevent them from having an asthma attack. Alternatively, if they know that animal hair triggers their asthma attacks and they're about to walk onto a farm, they might have a couple of puffs of this before they walk into that environment to prevent them from having an asthma attack. In terms of how this device works, at the top here we've got a little canister that contains some chemicals. This then slots into a tube, and if we take off this cap, we can press down on the canister and the chemicals in a powder form will shoot out of the tube like so. We want the person to put this over their lips and to take nice long deep breaths to inhale the powder. We used to recommend you take a short sharp breath, but we don't recommend that anymore because what would happen is the powder would just rush through the system and the chemicals inside this device wouldn't properly coat the airway. So instead, we want the person to take a nice long deep breath and inhale the powder so that those chemicals coat the airway and help to stop that mucus from building up on the lining of the airway and also prevent the muscles from going into spasm. You should follow the instructions on your prescription medication in terms of the number of doses that you take, but most asthmatics take 2 puffs morning and night or 2 puffs before they go into an environment with one of their triggers to prevent them from having an asthma attack. So that's our brown inhaler. The next type of inhaler that we have is a blue inhaler. This is a reliever, so we take this one when we're actually having an asthma attack. It works in a very similar way. We've got a canister here with some chemicals and then we can shoot those down the tube and inhale those in. In terms of the number of puffs we recommend the person takes from this, usually the standard guidance is that you should take 2 puffs every 2 minutes until you hit 10 puffs or 10 minutes, which is obviously the same. So if someone's having an asthma attack, you can advise them to take their own medication, and usually that person will take 2 puffs every 2 minutes until they hit 10 puffs or 10 minutes, which is obviously the same. But you should always follow the prescription guidance that you're given with these devices. So they're these 2 standard inhalers. The brown one is a preventative. We take this one maybe morning and night to prevent us from having an asthma attack. The blue one is a reliever. So we take this one when we're actually having an asthma attack to relieve the symptoms. 2 puffs every 2 minutes until you hit 10 puffs or 10 minutes. Now, on top of these two devices, there are lots of other devices that are used to manage asthma attacks. There are lots of other asthma pumps of different shapes and sizes. This is an example of a slightly different asthma pump. If you see anything like this, which isn't your standard blue or brown inhaler, then we recommend you follow the prescription advice that you've been given with this device, because in some cases you can overdose on the device or take too many puffs from it. So you should follow the guidance you've been given with the prescription if you see any other device that isn't one of these. Now, young children in particular often struggle to inhale the medication from an asthma pump. So what you sometimes find is they're given one of these devices, which is called a spacer. If you see this, you don't need to be alarmed. This is just standard practice, particularly for young children, to help them inhale the drugs inside an asthma pump. The way it works is you're going to take your asthma pump, we'll take off the cap, and we're going to slip one end of it into one end of the spacer. We can now do a couple of puffs into this chamber, and we'd now encourage the child to breathe in and out of the other end for a couple of minutes. And this just helps them to inhale the powder nice and slowly and help the chemicals to coat the lining of your airway. If you don't see any signs of improvement once the person's used their own medication, then you should choose to call for an ambulance, because in some cases, asthma attacks can be very serious. If we have to put a time limit on when you should call an ambulance, we'd usually say if you haven't seen any improvements within 5 minutes, then you should choose to call for an ambulance, because the medication should have worked by this point. Most asthmatics are used to managing their asthma attacks using some form of medication. So they'll usually signal to you if the medication isn't working in the normal way, and you can take that message as a signal to call for an ambulance straight away and get that person some professional help. If you've got someone who's having an asthma attack and they don't have any medication, then the most important thing to do is just try and keep them calm and encourage them to take nice long, deep breaths. You also want to try and keep the diaphragm nice and open. You don't usually want them hunched over. So you can encourage them to sit on the back of a chair with their arms on top, because this will help to keep the diaphragm nice and open as well. So to recap, asthma is a very common lung condition that can cause difficulties breathing. It's very easy to spot someone that's having an asthma attack because you'll notice they've got difficulty breathing, you'll hear the air struggling to pass through their system, and they might start to panic. In terms of the treatment, you want to try and calm and reassure that casualty, encourage them to take their own medication, and if you see no signs of improvement, then you should choose to call for an ambulance.